Good afternoon, everybody. Thanks so much for tuning in. Grateful to have the opportunity to touch base. This is our first town hall that we've done since we suspended our campaign, and wanted to take that opportunity to reach on out, to connect directly, to give you an update as to where things are here in Massachusetts, which, again, I think like everywhere else, is evolving quickly. Give you a quick update as to what happened this week down in Washington and what I've been up to. And then I am thrilled to have a dear friend that's going to be, that is on the phone now and is going to be opening himself up to questions, John Santiago, who's an emergency room doctor and a state representative here in Massachusetts. He actually just worked an overnight shift at Boston Medical Center last night. And so he's going to tell us a bit about what he saw, where he believes we are in the midst of this pandemic, where we're going, and what critically people need to do to take care of themselves, their families, and our community. So I'm thrilled to have John on the line, and understanding that his advice on this is going to be absolutely critical. So he's agreed to take some questions too, for a couple of minutes while we're doing this town hall. So a quick little recap of kind of where we were and how we got to where we are. Late last week, we did announce that we were going to be suspending all campaign activity for the foreseeable future, for at least the next week, given the pandemic. We've been running, as you all know, a very aggressive retail-based campaign, a lot of handshakes, a lot of high fives, a lot of fist bumps, a lot of hugs, and you just can't do that right now. And we wanted to make sure that we were being responsible, taking care of the health of my volunteers, myself, and obviously any of the supporters that wanted to come out and engage in this race. And so I think that's critically the most important step, is to make sure that we are keeping the health and safety of the people of Massachusetts and our families at the forefront. We will reevaluate as to where we are next Saturday and take it from there. In the meantime, we will continue to organize digitally with exclusively around a coronavirus to make sure that you all get answers to questions that you need. We keep you updated about where things are going to the best extent we possibly can. And a lot has happened this past week. Was down in Washington and spent most of the time actually on the phone with folks back up here, trying to make sure that we were in constant contact with the healthcare providers in my district, community health centers, hospitals, doctors, making sure we knew exactly where they were in this process, what they needed, and that we were pushing forward for some of those accommodations in our relief packages that we've worked on so far. And up till now, the House of Representatives have passed two. The first was over a week ago, where we passed $8.5 billion as an initial package to try to shore up the initial emergency response for our frontline community. So particularly institutions like community health centers, accommodations for Medicare to ensure that we could in fact evaluate people in their homes through mechanisms called telemedicine, and a number of other procedures to try to, as we say, flatten that curve in terms of exposure and make sure we can get this initial response right, provide additional resources to key communities that needed it. The second response that the House of Representatives passed at about 12:30 in the morning, early Saturday morning, was focused on our families, trying to, in the midst of massive amounts of uncertainty out there, trying to provide some reassurance to the American families that we're going to get through this, and you're not going to face economic devastation because you or a loved one happens to get sick. There are 5 big components to this bill. First off was testing. Clearly, you need to make sure that not only does everybody who need a test get one, which is what we're fighting for aggressively in addition to this bill, but to make sure that you didn't have to spend hundreds, if not thousands of dollars in order to actually get a test, or if you got one, that you would get billed for it. So ensuring that all tests were going to, the cost of every test was going to be covered for free. Second, to make sure that there was, in fact, a paid leave package and a paid family medical leave package, so that if you got sick, you didn't have to choose between going to work or keeping your roof over your head or food on your plate or caring for your family. And by the way, if a family member got sick, if they got a child or a parent, that somebody could take the time to care for them and not have to go back into the workforce to try to perhaps contaminate somebody else, or just be able to, again, care for their family. We strengthened Medicaid a bit further, understanding that Medicaid is still going to be on the front lines of this crisis, and we need to do more in order to ensure that that system remains strong. We also increased unemployment insurance, understanding that if the economic devastation that might come with this could leave some businesses to close, that if there are layoffs, that we didn't want to make sure that, or we wanted to ensure that people didn't then face losing their home, losing their car, losing access to food because of the dislocation that comes with the disease. And last was food assistance. It's been a question that a lot of folks have been calling in about, understanding that over 20 million children get access to healthy food from school meals, and that if all schools are closed, as they are, many are in Massachusetts, that if kids aren't getting that food at school, then they're going to have to get it at home at a time when budgets are already stretched to the max. And so we passed a big package of food aid to make sure that children, seniors, and others continue to get access to food and plush up food stamps. That's critically important. We got a long, long way to go. I spoke to Speaker Pelosi on the House floor at 12:30 in the morning, early Saturday morning, already about what this next package is going to look like. We traded emails, or we got an email from her this weekend, and a conference call going forward on Monday afternoon with our Democratic caucus, talking about what this next package is going to look like. And we know that our work is far from over here. Just domestically here in Massachusetts, look, we're seeing an drastic increase in number of cases. We are finally seeing an increase in testing, although that testing isn't anywhere near where it needs to be. But we do expect that this is going to get a lot worse before it gets better. And John can talk about that. Dr. Santiago can talk about that a bit in a second. But in the meantime, I do want to urge everybody to engage in those practices that we need to engage in order to keep ourselves and our community healthy. Engage in that social distancing, right? Just to the greatest extent you possibly can. Stay home, stay out of highly trafficked areas, stay away from big, large crowds. Governor Baker has declared a state of emergency, making sure that there's no gatherings of over 250 people. We want to make sure that personal interactions remain limited. Wash your hands before you get inside, certainly multiple times before you eat. Disinfect your phones and tablets, stuff that you're touching all the time carries an awful lot of diseases and germs. We want to make sure you're wiping those down. Try to make sure, certainly before you eat anything, we want to do everything we can to try to make sure we're mitigating the spread of this disease. My focus over the course of the past couple of weeks has been, one, making sure that our communities back home are getting what they need, and to the extent that they haven't yet, to know exactly what that is so that we can push for it in the next package. To be focused on folks that need that help most, so community health centers. We've advocated very strongly for additional funding there because they're going to need it. Making sure that test is free, which has been a big focus of mine and a couple of others. Ayanna Pressley and others pushed the administration very hard on this, and we're able to get there, which is great news. And making sure that our Medicaid system remains, has the tools that it needs to respond to this crisis, because this is where, for folks that would otherwise fall through the cracks, this is how a pandemic perpetuates and spreads. And we need to make sure we've got the tools to address it. A lot more to talk about, but I do want to get to John. John Santiago, Representative Santiago, is a dear friend. He and I actually go back a long way, long before he was an elected official. He replaced me in the Peace Corps in the Dominican Republic. So he and I have known each other for a while. Thrilled to have, to call him a friend, and a huge admirer of his work and all that he does. So we've got him on the phone here, and I'm going to unmute him now. As I said, he's an emergency room doctor, and he worked an overnight shift last night at Boston Medical Center. And John would love to, Dr. Santiago, Representative, first off, welcome. Second, thank you for what you do. Third, would love to have you just explain to folks a little bit more about coronavirus that I left out. Two, what they should be doing. And three, just tell us what you saw last night and tell us what we should expect coming forward.
Great. Well, Joe, Congressman Kennedy, I just want to start off by thanking you for all the work you're doing on this. I mean, there have been few elected officials who have been so more outspoken than what you've been doing, whether it's this town hall or ones you've done in the past, really fighting for us in Washington. Because I think, as you highlighted, it's not just about the testing and the stockpiling. It's really about making sure that we take care of our most vulnerable communities. And this is something that, whether I'm in the state legislature or whether I'm in the emergency room, working with these communities, that it's a priority that's always on my mind. And so, there's no doubt the last couple of weeks have been challenging, particularly this past week. And the game has changed. Governor Baker has had a state of emergency. the president as well. But let me just say that the way that the president and the White House has handled this from the beginning is really it's put us in a position that it's really going to be hard to come out of. As I've often said the last couple of days, it's going to get significantly worse before it gets better. And so we're in the fight. And so we're doing what we can do we're kind of past the containment stage right now. We know that community spread is going on. We know that folks who have not traveled are being exposed to people who have coronavirus and passing along the virus. And so in the state of Massachusetts, a big issue that we're having right now, I'd say across the country, particularly vis-a-vis other places, is the lack of testing. And that's two reasons. One, there was a significantly narrow guideline with respect to who we're testing. And so, we've had up until Friday, March 11th, we've tested 475 people in Massachusetts, 138 of which have been positive. But one can only imagine how many more people are out there that need to be tested. But there's not enough tests. The guidelines have been narrow, and so that's where we're at. And so a couple of days ago when I entered the emergency department, I'd been working the last couple of weekends. Obviously, you heard about the coronavirus. It's wintertime, flu season. Let me just say that hospitals, particularly emergency departments and those that work with in big urban centers like the one I work in, we're always at capacity. There are always beds in the hallway. There are always people waiting to be admitted who were bored in the emergency room. But this is at some significant strain to the healthcare system at large. And so as we move forward in this, and we'll see what comes and how the virus continues to expand, but it really puts our healthcare system at risk. And that's something that has me concerned. So the last 2 nights I've worked overnight. I'm working 3 out of 3 tonight. And it's been challenging. You walk in there and you see your colleagues and your nursing colleagues or your physician colleagues. And, I don't want to sound alarmist. I'm concerned when I go in there. But, people walking around with COVID or that you could suspicious of COVID-19. Everyone has masks on. There's a question of, where can you get the mask? Why isn't there enough hand sanitizer? And so that's been challenging for sure. But the fact is that a lot of people, because of the misinformation, because of some of the panic out there, people are flooding the emergency room and seeking answers and care. And right now, because the epidemic is so new, we just don't have all the answers. And so that's been another challenging piece. And so we're doing the best we can to make sure that folks are educated, aware, and that it comes, where they don't have, hopefully end up in the emergency department, or we can really educate them on the role of social distancing and good hygiene to kind of prevent transmission. So I'll leave it there, and I don't know if however you want to move forward with this, Joe, or take questions, or you have questions for me, or.
Yeah, I got a million questions for you, pal. But
Yeah.
So what we've done, we've got a bunch of folks that have already written in questions off of our Facebook page, knowing that you were going to be on. So we'll start with those and then curate some more as we go through this. But let me start again just by saying grateful, Doctor, for what you're doing. And you guys are on the front lines of this, and I know that it's no one should take that for granted or say that it's easy. We've got reports, obviously, of, I think, as you know, about 70 nurses that are in quarantine out in Western Massachusetts. A doctor at another Boston hospital that was diagnosed with the virus. So obviously, know that you're dedicating yourself to take care of all of us, but obviously you need you to take care of yourself too, so you can take care of the rest of us. So thanks for what you're doing. First question is from Susan from Arlington for the doctor. And Susan says, what is being done to convey to folks the importance of cutting out these non-essential outings so that we can actually flatten the curve? That one's for you, pal.
That's a great question. I think flattening the curve has to be the priority right now. And what that means is essentially limiting contamination spread of the virus. And so the term social distancing has popped up in the last couple of weeks or so. And it's really good. It's incumbent upon elected officials, your leaders, not just in the government but also in the medical community, to really say and sit down and say to everyone the importance of not going out if you don't need to be out. Right? This virus is spread from person to person. So the importance of good hygiene, being 6 feet away from people, and what you've seen over the past last couple of days is elected officials move closer to that. I mean, we've canceled schools here in Boston. We've had a whole bunch of cities and towns across the state that have as well. Just an hour ago, the mayor of Boston, Marty Walsh, declared a public health emergency, really limiting access to bars, restaurants, nightclubs in Boston. And if you see how the epidemic is playing out in Europe, where there are thousands of more cases, many more deaths, that's where they're moving to. In fact, in France, just yesterday, they closed everything down. The only that's open, I think it's gas stations, pharmacies, and hospitals, and maybe another thing. And we might be headed there as well. But it's so important to stop the spread before it gets infected, before we continue to affect other people.
Thank you, John. The second question is from Amy from Boston, and it's a question for me. What more can leaders, public health, political, business, academia, and other do to encourage social distancing in a more meaningful manner than is currently taking place? So, Amy, great question. I think one thing we could do is have opportunities like this and bring on medical experts that are on the front lines of this to tell you what exactly we need to do to combat this epidemic. And you've got, again, Dr. Santiago here that is seeing the consequence of what happens when we don't actually engage in sufficient preventive measures, and the burden that it then is putting on our healthcare system to try to respond to this in the best way that we can. I think it is also critically important for public officials, leaders, whatever else, to go out there and model that behavior, which you've seen from me since this pandemic did start to spread. Again, shutting down, suspending our campaign for at least a week and reevaluating. Spending a lot of time back with my family and back at home, trying to engage in these practices as well. Trying to leverage platforms, media interviews, Facebook interviews, opportunities like this to get that information out about proper hygiene, about the importance of social distancing, and clear and consistent communication with people so that particularly as information is changing so rapidly, they can stay up to date and informed. And just ask that you pass it along. Obviously, parts of this are taking hold. There's a lot more folks that have heard the term flattening the curve or social distancing now that know what that means than they did 2 weeks ago. We need to make sure people not just know what it means, but then know why they have to do it and what it looks like in order to do so effectively. And one last piece, I know we've been focusing an awful lot on washing hands. I can't stress enough the importance of, if you do have to go out, make sure the first thing you do when you come in home, wash your hands. Again, just try to limit the spread of these germs from either getting into the place that you spend the most time in and you occupy, because we want to make sure that place stays safe. John, any thoughts there, or you want to get to the next question?
I think you're right on. I think because the way the virus has kind of shown itself to be, we see that a large number of young people are relatively more asymptomatic. That is to say that they don't always present with the fever and the cough, and they don't always want to stay home. So they might look well. They in fact might not exhibit any symptoms, right, but they could be going out and sharing the virus. And so I think, yes, this past weekend, there were pictures that were put on social media, St. Patrick's festivities, and a whole bunch of young people were out. And I think there has to be concerted effort, particularly among youth, young people who think that that they're not at risk for this disease. They are, and they're at risk for spreading it to more vulnerable communities, their parents, their grandparents, and people with chronic lung diseases and the like. And so I think, a more concerted effort to reach out to our younger demographics would behoove all of us.
Yeah, I agree. So Stephanie on Facebook has a question for you, Representative. Any advice for ordering takeout? We want everyone to be safe and still support local businesses, but I see a lot of people on social media claiming that you can't get it from food. What do you recommend? Great question.
Well, I mean, it's not whether you can get it from food or not. It's whether the person delivering the supplies, be it food or what have you, is contaminating the bag, the door that he opens, and that sort of thing. So, what we've done in my house, I mean, my wife, we went to the supermarket, we kind of, bought food for a couple of days, and we've, had Amazon deliver food for, the next couple of days as well. But I would say your risk of contracting the virus is probably less likely if you stay at home and ordering food and taking precautions such as that, vis-a-vis going out, being at some restaurants, sitting 1 foot away from somebody else. So I would just really limit your, again, practice social distancing, stay inside as long as you can, whenever you can. It's also important to know that you can go outside. I talked to a good friend today. He walked outside. He lives in a fairly rural place. I said, hey, you can go outside. There's no one around you. He took a 4 or 5 mile walk. So I think it's an important time to sit back, reflect, take care of your friends, families, and maybe pick up another hobby. But the less likely you are to go outside and interact with people, the less likely you are to catch the virus and potentially spread it.
2 things there, John, just to make sure people understand. So it's a beautiful day today in Massachusetts. It is okay for folks to, the point of staying at home is trying to socially distance. If, you have the opportunity to go walk around the Charles River, is that something that you think is an okay thing to do, to go out for a walk in the woods, to go out for a jog? That's okay, right? As long as you're not jogging, next to a whole bunch of other folks.
Well, I wouldn't say whether the problem is that, if you tell 1 million people to do that, then you'll have 1 million people on the Charles River. Right?
Fair enough.
And so what I would say, if, the one guy I was speaking to was a colleague of mine, and he has some property in his backyard and maybe in the small town where he lives. So I said, yeah, you can, feel free to go outside. Some people, I would maybe lay low from the gym. Some people, I've seen my gym pick up because people have stayed home, but they feel the need to go to the gym, and everyone's, when you're on the elliptical or the treadmill, everyone's sweating, not washing their hands necessarily as well as they should be. So I would probably limit my going to the gym, going to churches. The idea is to stay away from people, to increase the distance at which you're, participating in kind of communal activities. But I understand you have to weigh, this is a difficult, no decisions are made lightly, and, anything we do will have some sort of unintended consequence. And so, it's an imperfect trade-off, right? And so you have to balance your mental health, and some maybe your physical goals or what have you, with, the desire to really stop the transmission of the virus.
Right. Okay. Thank you. Linda from Springfield says, for me, Joe, will you please tell us how you define leadership and what political leadership looks like to you in times of challenge? Linda, wow. So look, I think at this point, I think the basic tenets here are relatively straightforward. It's communicate clearly. It's understand what people in your community are feeling, the anxiety, the fear, the uncertainty. Do your best to be honest with everybody. I don't think we should or can sugarcoat this. We are going to be tested in a way that we never have been in modern American history. And so people need to be prepared for that. But I also think it's important not to panic people, because there's not reason to panic. There's reasons to be prepared. There's reasons to be wary. There's reasons to follow great advice like Dr. Santiago is giving everybody. But if we are prepared, if we engage in these practices, if you engage in good hygiene, if you socially distance, if you engage in these activities over the course of the next couple of weeks, hopefully we are able to mitigate the impact of the virus. And that's really what we're hoping for. And I think the best that we can do, but each of us can, in fact, play our part. If you are concerned that you have been exposed or could be sick, quarantine yourself, please. Because if you don't, you're going to spread this to somebody else. And this is part of the problem that John already referenced earlier, is that particularly for young people, you might be asymptomatic, but it doesn't mean you're not spreading it to other people. And so we really need to take that advice to heart. So being honest, clearly communicating, modeling that activity and behavior for yourself and your own family, and then speaking up and speaking out so that we are able to do the things we need to do to get through this with as little a disruption as possible, understanding that this is going to be quite painful for an awful lot of folks, and we need to be there for them as we get through this. And I guess the last piece of advice I give you is, in all likelihood, just as Dr. Santiago referenced, this is going to be a fairly stressful time for folks, given the anxiety for people's health and that of their loved ones, economically, financially, and otherwise. go out of your way to be a little bit more patient and a little bit just be nice to everybody, because tempers are going to be short and people are going to be on edge. And this is a time when you can call, check in with somebody, drop them a text, shoot them a note, check in with folks on Facebook, just because it's nice to know that people are thinking about you and are checking in on you, because we all need that right about now. John, I got one for you from Adam from Northampton. What will we do if all the doctors, nurses, and other hospital personnel like you get sick? Are you taking precautions and your shifts at the hospital? Great question. Go for it.
That's a great question. I mean, I think once the healthcare workforce is decimated, I mean, you put yourself in a significant hole. So we at the hospital are taking extraordinary precautions to make sure that we are gowned up, we have multiple masks on, that we're following CDC guidelines, that we're washing hands appropriately, because it is no more clear to the healthcare workforce that once we go down, the situation's going to be completely out of control. And so when we're in the emergency department, in my hospital, we actually have tents outside, which we're looking to staff up relatively soon, because ideally you wouldn't want to bring a person with COVID-19 into the emergency room, right, infecting everyone and transmitting the virus. And so the ideal situation is to have someone triaged, and if they have certain risk factors that put them that could result in COVID-19, is to get them out of the emergency department as quick as possible. Now, again, the vast majority of people, up to 80%, they'll have mild symptoms, so they don't need to be hospitalized. And so we get them, we test them, and then we send them on their merry way. But make no mistake, I mean, the healthcare workforce, the physicians, nurses, the unit coordinators, secretaries, everyone's on high alert. The morale has been high, although challenging situation. But we realize that it's important to take care of ourselves. And it's something that, physicians and medical community has lived by for a long time. I mean, we can't take care of other people if we're not taking care of ourselves.
But John, so how does that work when, you're working, so you've got a day job as a representative, you've working 3 overnight shifts in a row. If there is a surge here and they need you, how do you do this? Understanding that it's great that morale is high now. It's I would assume hard to keep that up when you're working 18 to 20 hour shifts, multiple days a week for potentially a long time. So how do we think about that? Not just this conversation has come up with questions that I've had about a bit lately of saying, look, our healthcare system, particularly here in Massachusetts, is as good as you'll find literally anywhere in the world, if not better. We've had experience with kind of short-lived events where we had the triage and we had the surge immediately, right? Probably most memorably in recent history, the Boston Marathon bombing, where we had this enormous amount of activity in our healthcare system. But that wasn't for weeks; that was for days. So, how to just talk us through what this means for you as this thing, as I think everybody believes, is ramping up at this point, but is already putting a fair amount of stress on people.
I mean, well, on a personal level, I kind of listen to my mother when it comes to this. I eat well. I try to get my sleep, and I try to take a couple of minutes a day just to kind of meditate and reflect on what's going on. Because again, once you exhaust yourself, and let me just say, like, if you're a physician out there, the fact that you went through residency alone and you know what that means, working 80 plus hours a week, 16 to 20 hour shifts, you've been burnt out before. Likely you've been burnt out before. You know what it feels to work a lot and in very challenging conditions. But given the state of affairs, that's very well where we could end up. Yep. And that's the most concerning part. I mean, you just have to look at what's going on in Europe right now, and hear the stories coming from Italy and France and Spain, no less China a couple of weeks before that. It could get very bad. And that's why it's going to be incumbent upon hospital leadership, the medical community, state and local officials, and folks like yourself to really step up and show some leadership. And like what you said earlier with respect to your definition of leadership. And the one thing that you didn't say, but you said without saying, was empathy. But right now, there's such a lack of empathy coming from our president that it's just it's completely I can't even get over it. And I think about my role in the emergency room, and I think even as an elected official, and I think you probably agree with this as well, even when we were Peace Corps volunteers, when we went into situations where we didn't always have the answer, or maybe there were situations beset in 100 years of slavery, or things that you couldn't fix immediately, but you were there to listen, learn, and empathize, and that in and of itself can be a cathartic thing. And so when I'm in the emergency room, even before COVID-19, when someone came in with high blood pressure or had a stroke because they couldn't pay for the medication, the fact that I could listen to them, empathize with them, and just share with them that moment and give them that peace was really comforting. And so I really look to the elected officials, government folks in the medical community to listen, to be transparent, to be calm with just anyone who wants to talk about this, whether it's their patients, their constituents, and their neighbors.
Yeah. Thank you. So we got a last question here for you and me, and it's from Tim from Beverly, who writes, what steps should the government have taken prior to the coronavirus outbreak, and what should our steps be for future years to be prepared for events like this? Tim, great question. I'll give you a couple off the bat, and I'll kick it to the doctor for his final thoughts. One, you don't gut the government personnel that is put in place to actually prepare for events like this. Contrary to what the president has said, we 100% knew that there was going to be a pandemic because we had multiple pandemics over the course of the past several years. You don't know what exactly it's going to look like. You don't know when it's going to hit. You don't know how it's going to impact society. But we saw Ebola, we saw MERS, we saw H1N1, we saw swine flu. We've seen these. What we learned from those is that government has an essential role of getting prepared across our own society and interacting with other countries around the world because they don't have as robust a public health infrastructure as we do. But working with them can actually effectively contain it. And what we saw from this administration was they came in and they gutted those, they threw out those recommendations, and they said, this is never going to happen on our watch. Well, of course it was, because we've seen all the rest of these happen in the past several years, and it's eminently predictable, not that this would have happened now in the way it did, but that something would have happened. And that's why you have it. Look, we pay for fire hydrants all over this country, not because we expect to use them, but because we're glad they're there when we need them. That's the whole point. And they decided that it wasn't worth investing in. Two, that engagement with an international community. You can't go out there and target it every single day and try to destroy it, and then need to rely on it to work with international partners to curb the spread of this virus. And look, part of that is on perhaps on the Chinese in terms of engaging with us earlier, as they could have and should have. But part of that is then the overall way in which this administration has engaged in international diplomacy, which has been devastatingly ineffective and certainly didn't help. And then three, rather than trying to hope that we could get through this with minimal economic dislocation, recognize that if this did play out the way that it started to play out in China, the way that it started to play out in Japan, the way it started in South Korea, that the way you get in front of it is by aggressive action immediately, and you can in fact stem the tide of it. We saw that in South Korea. What they tried to do was to hope that it wasn't going to impact the stock market so badly, hope that it wasn't going to impact our economy so badly, and that you could somewhat massage your way or mitigate your way through this without having to take drastic measures. Well, the problem is that if you're wrong on that, the economic dislocation can be devastating. And we saw that when the stock market lost 30% of its value in about 10 days. That's why you move aggressively. And this administration didn't in a myriad of ways. So from the failures on testing with the CDC, through the travel restrictions, through the lack of communication with states, and the lack of authority given to states to effectively respond. I think there's a whole bunch of ways there. And so that is what it is, and we got to fight our way through it. We're depending on folks like John to do so. So, Doc, I'll give you the last word on this question. What could the government have done, and what should be our lesson going forward?
No, I think you hit on all the important spots. I mean, let's just be clear that the Trump administration has set us up for failure, and we're trying to crawl out of a hole right now. But the only thing I'll add, which I think you would agree with, is that it's just not the past 4 years of the Trump administration. It's about what's gone on in our country for the past 20, 30 years, the growing inequality, the lack of safety net for our most vulnerable communities. those are the people and patients that I care about. Those are the people I work for. And I think electing leaders that care about that, they're going to work for a more equal system, a better healthcare system. I think that's what we have to do.
And go ahead.
No, that's it. Yeah.
So I think that's a great place to end on, because the last part of that question, Tim, was what do we do going forward? Look, coronavirus, just as John was talking about, has the potential to actually show how our society, how fractured and fragmented it has become. Right? We look at the impact of folks that don't have paid leave, and what that can mean. You look at the impact of people that have or had initially access to insurance that would cover the test versus some that didn't. An individual that was looking at a several $1,000 bill, even though he was insured, but his insurance wasn't going to cover the cost of the testing. You look at what happens when you have food security versus when you don't. When you have when 40% of the American public can't come up with $400 in the case of emergency, well, what are they supposed to do when you have to prepare to not leave your house for a couple weeks to be able to buy groceries if you're not necessarily getting a paycheck? This is a clarion call for our government to actually address these structural inequities, not just because they're the right thing to do, but because if you believe that these pandemics or incidents like this are going to increase going forward, this is how we actually protect all of us. There's only so far you can tax cut your way to success and think that it's not going to come back and bite you. And that, I hope, is the lesson that Congress takes out of this. And so far, it's certainly the lesson the Democratic House is trying to push. We've gotten some resistance from this administration and Republicans in this fight over paid leave, but we will keep pushing. I want to wrap up there. Please keep in touch. We're going to continue to do these and a whole bunch of additional communication off of our website, Kennedy4ma.com, and there's going to be updates there consistently about coronavirus and what we need to do, where we are, and what is happening, updates down from what's going on in Washington, around the state. And urge everybody, there's a website, I think, at the bottom of the screen, too, that you can click on to follow along and get the latest. So thanks very much for tuning in. Doc, grateful for your service and your friendship, as always, my friend. Stay healthy and stay safe, all right? And thanks, everybody.
Thanks, guys.